Welcome to this video, which is a part of a series of trainings offered by the Midwest Center for School Mental Health. Our series offers guidance for developing and implementing effective school-based mental health systems. My name is Dr. Mark Sander, and I serve as co-director for the Midwest Center. In this training, I will share some of the best practices related to mental health screening in schools. But before we start talking about mental health screening, it is important to talk about the overarching vision of safe and supportive schools, which include three critical frameworks: the Comprehensive School Mental Health Systems Framework, the Culturally Responsive Anti-Racist and Equity Framework, or CARE, and Trauma-Informed Healing-Centered Framework. These frameworks are important because they set the context for climate and culture in schools. Briefly, the Comprehensive School Mental Health Systems Framework was developed by the National Center for School Mental Health and the Mental Health Technology Transfer Center, consisting of 8 best practice modules, and screening is one of those modules. The goal of the Comprehensive School Mental Health Systems Framework is to give districts and schools concrete information and tools that they can use to implement best practices and build effective systems to support the mental health and well-being of all students and families. The second model is the CARE model, which is a mindset and a set of values that need to be a part of all that we do in schools. The C is for cultural responsiveness, meaning that students, families, and educators' cultural references, identity, beliefs, and rituals are included in all aspects of the school environment and educational approaches, including supports and services that promote the well-being and mental health of all. The AR is for anti-racist. Schools that are implementing the CARE model actively and intentionally promote school policies and practices that center equity and oppose racism and other forms of oppression. Lastly is the E for equity, which is ensuring that every student has what they need to achieve academically and experience positive mental health and well-being. Lastly is the trauma-informed healing-centered approach. It is important that members of your district or school screening team understand and incorporate these values into their work. There are 5 critical values. First, understanding the impact of adversity and trauma on students, families, and staff can lead us to understanding individuals' behavior through a different lens. 2, believing in the power of safe, authentic, and positive relationships to create healing. 3, committing to creating emotional and physical safety for all. 4, making sure that when we think about students, we're thinking about them holistically. And 5, recognizing the importance of creating opportunities for choice, control, and empowerment for students, families, and staff. Now that we have set the context for the environments and values that we hope your district and school screening teams will work within, let's talk about how they can begin implementing mental health screening. First of all, what is mental health screening? It is using a tool or process across an entire population, such as your school's student body, or perhaps it's just a grade level, or maybe it's just a classroom. And we're doing that to identify students' strengths and needs. Screening oftentimes is used to identify students at risk for mental health or substance use concerns. So why screen? Why should we do this? Recent years have seen a growing awareness and concern about mental health and well-being of children and adolescents. Nationally, 1 in 5 children and adolescents are estimated to have a diagnosable mental health disorder, such as depression, anxiety, or attention deficit disorder. Many communities have seen increases in recent years in the number of children or youth describing feelings of sadness, hopelessness, or stress. While mental health services can be offered in a variety of settings, we know that school-based mental health services are especially important. Children and youth receive mental health care in schools more frequently than any other setting, including doctor's offices or mental health clinics. Another reason why mental health screening is important is it can provide data for your multi-tiered system of support, MTSS work, and through that inform prevention and early intervention strategies at your school. It can help identify concerns in specific grades or classrooms, or perhaps concerns that are shared across your entire school, which can then help schools determine what types of supports are needed for your students. It can also help identify students at risk for mental health concerns or students who are at risk for harming themselves. School mental health screening can improve access to mental health supports by helping schools understand what kinds of supports are needed by students, and then help that school identify appropriate resources to support those needs. As I move through the next part of this video, and we talk about the 6 action steps towards implementing mental health screening at your school, I would like to share with you a suggestion. Start small. Starting in small increments will enable you to learn what is working and what isn't working in your screening process, and will allow you to make course corrections as needed, and then you can scale up. But start small first. All right, let's move on to the 6 critical action steps in implementing mental health screening in your school. They are: 1, build a foundation; 2, clarify goals; 3, identify resources and logistics; 4, select an appropriate screening tool; 5, develop consent and assent procedures; and 6, develop data collection, administration, and follow-up procedures. As your school or district moves forward on developing your protocol for mental health screening, it is really important to build a strong foundation, and that starts with assembling a multidisciplinary team that involves not only school administrators and school staff, but also community members, mental health partners, students, and families. This team is critical. They will help you build the foundation of support you will need, as well as help you reflect on critical questions so that your screening protocol that you develop is the best fit for your students and families and is aligned with the context of your community and your school. Once you have assembled your team, the next step is to generate engagement and support from youth, families, the community, and your school. You should include students and families in all parts of the development and implementation and review of your screening protocol. It will be important for you to utilize several different approaches in gathering feedback. Some of these are using focus groups, parent meetings, staff meetings, as well as opportunities for individuals, both school staff and community and parents, to provide feedback in written form. In addition to these activities to gather input from stakeholders, you'll need to strategize about how your goals for screening fit in with other initiatives at your school and in the district. The more that your screening goals align with the initiatives you already have at your school, the better chance you have of success in getting your screening process and event to move forward. Earlier in the video, we spoke about the CARE model. One way that we can make sure that the CARE model is infused into the work of your mental health screening plans is to make sure that your team is thinking about cultural considerations. It will be important for your team to understand cultural values and unique considerations of different communities and subgroups of students as you're planning for your mental health screening efforts. For example, some of your students and families might be experiencing complex stress related to poverty, to the immigration process, and/or language barriers. And these must be taken into account in terms of screening content and process. Families within and across cultural groups may hold different beliefs about mental health and how mental health concerns should be addressed. This is why your focus groups and engagement efforts are so important. Your screening team needs to meet with these cultural groups and talk about their views on mental health, and for you to learn from them and incorporate their views into your process of thinking through how to select your screening tool and also how to conduct your screening process and your screening event. We know cross-cultural groups for families are more supportive of screening when it takes a strength-based approach and when we take into account language and cultural beliefs. The last recommendation around building a foundation is using data to support your screening efforts. Data can help support the need for doing your mental health screening, and you could use national data to make the case about why you need to be doing screening at your school, or perhaps you've got local data. For example, one school district did a small screening pilot, and from that, they had data that could demonstrate the value of screening. They found students who scored in the moderate to severe range for depression were absent 47% more often than students who scored in the average range. In that same district, they found that the GPA was consistently lower for students who scored in the moderate to severe range on 2 different mental health screeners than for students who scored in the normal range. It is important that you're able to show the stakeholders how you could be using this data to support a more targeted and strategic approach to supporting students with mental health to be successfully academically. The next step in planning your screening protocol is to clarify your goals. So what are your goals for your screening efforts? It's really important that your team clearly identifies the purpose of the screening and the desired outcomes. So I'll give you a few examples that we've heard in the past of possible screening goals. So 1, screen all 6th grade students for anxiety to inform who may benefit from additional support during the transition to middle school. Another possible goal is screen all 9th grade students for depression, including suicidal thoughts, right? And this would be to improve the identification of students for counseling support and also to inform school-wide suicide prevention efforts. Screen all students in your district for school connectedness. And the goal of this is to identify schools that have high rates of school connectedness and then learn from their efforts to improve the school connectedness in other buildings. As you can see, these are 3 very different goals for screening. Your team needs to decide what their goal is for screening. And again, remember, start small. You can always scale up after you've figured out the process and attempted your screening efforts a few times. Now that we've identified your goals and utilized the CARE framework to help put an equity and cultural lens on it, the next step is identifying the staffing and community resources you'll need when you conduct your mental health screening. Your team should collaborate with other school mental health professionals, such as school counselors, school psychologists, school social workers, and school nurses, as well as reaching out to community mental health partners to help support during the screening process. First of all, your team will need to get buy-in from these partners and help them understand your goals for the screening and be clear with them about how they can help and assist. Second, you will need to make sure that teachers and paraprofessionals are available so they can be in the classroom with students while the screener is being administered, and that they also know what to do if students are raising any concerns or having any reactions. Third, you will need staff to assist your team in coordinating follow-ups for students who are in need of immediate supports after the screener is completed and scored. It is also really important that both your school-based and community-based mental health providers have capacity for new referrals in a timely manner. This is why it's so important to have them available and part of all the different steps in developing the screening event and the screening protocol. Another question is about how are you going to administrate your screening tool? Are you going to do it electronically or use paper and pencil? The advantage to administering the tool electronically, obviously, it's a lot easier to collect and analyze the information electronically, and there's less chance of human error in the scoring. Some of the challenges to administering it electronically is that you'll need to find devices for all the students to use. If you're going to use paper and pencil, a more low-tech option, you'll need to make sure that you factor in the time for staff to score the screener by hand and then enter the information into a database of some kind so that the screening team can analyze that data. One of the limitations or concerns with using the paper and pencil version is that there could be human error involved in either scoring the screener or entering the screening data into the database. Now that we're done talking through setting up your staffing resources and logistics, we can move on to selecting an appropriate screening tool. When selecting a screening tool, your team must consider whether the tools are compatible with the purposes of your screening, are usable within the context of a school and with the population of your school, and lastly, have demonstrated strong psychometric properties in languages other than English that may be of importance at your school. Some additional questions for your screening team to consider when thinking about a screening tool are, is the screening tool reliable? Is it valid? And is it evidence-based? Another consideration is cost. Is it free or can it be purchased for a reasonable cost? Another question is, how long does it take to administer and score? And is there an electronic version of it to make it easier to score and administer? Does it come with easy access to training and technical support for staff? And lastly, does it screen for what we want to know? Some of the things you might want to know are things like type of mental health risk, or maybe you're looking for a positive mental health and well-being screener. And then another question is, does the tool fit the age range that we're looking for? Some screening tools are set and only validated for a certain age range. What if you're looking for a culturally responsive tool, screening tool, that meets all or most of the criteria that I just listed? Unfortunately, researchers are working on developing these tools, but currently there are very few well-tested culturally responsive screening measures. So what we encourage you to do is to screen, but really select the screening tool that best meets your needs, and then partner and consult with cultural liaisons, community members from the cultures that are represented in your schools, meet with those students and families to determine what concepts or phrasing may lead to misunderstanding across those cultural communities, and whether these limitations and concerns can be addressed through adapting the wording, or perhaps how the item is scored, are things to consider. Another strategy would be to have cultural liaisons and cultural brokers present during the screening administration, and that they're able to provide consultation and support to students who may have questions about what a certain screening item means. And additionally, we'll talk a little bit more about how to build in cultural responsiveness when analyzing the results. But this is one way to kind of build in the cultural responsiveness when we're thinking about the actual tool and the administration of the screening tool itself, because currently, unfortunately, there are not that many culturally responsive screening tools yet created. So as you're thinking about where do I find some of these tools? So I talked about the Comprehensive School Mental Health Systems framework that was created by the National Center for School Mental Health and the Mental Health Technology Transfer Center. Well, the National Center also created an online tool called the SHAPE system. SHAPE stands for School Health Assessment and Performance Evaluation System. And the SHAPE system is a tool, like I said, developed by the National Center, which helps school districts and schools do a self-assessment on the 8 domains of the Comprehensive School Mental Health Systems framework. Within the SHAPE system is a repository of different low-cost or free screening tools in their screening and assessment portion of the SHAPE system. So you can go in there, you can go to SHAPE, you can create your own account for free and get in there and look at a bunch of screening tools that they've compiled together, and they give you information about the age range, the cost of the measure, and a brief synopsis of what the screening tool looks like. All right, so now we're going to move on to the section where your team is going to determine your consent and assent procedures for your mental health screening. I'm just going to say here right now, like, there is no right answer for determining whether to do active or passive consent. I'm going to walk through some of the strengths of both and also to discuss some of their limitations so you can make the best decision for your school and district. First of all, you'll need to determine if there are any state laws or district policies that may impact your ability to use either active versus passive consent. If there are any laws or district policies in your area related to this, then you basically have your answer. And it might be passive, active consent. If you do have the flexibility to choose either active or passive consent, let me walk you through some of the strengths and challenges of each. So let's start with active consent, which means a student may only participate in your mental health screening if their parent or guardian gives written consent. The strength of this approach is that it ensures that consent is informed, and it also may be in line with your district protocol and policy. Additionally, doing active consent may establish a more trust between families and the school regarding your screening effort, right? Because there's more conversations perhaps about it, and the family is actively involved in saying yes. Some of the limitations around using active consent, I think you can guess. The big one is it may leave out students who, for whatever reason, were not able to obtain and return a signed consent form from their caregiver. So the other option is to use passive consent, or which sometimes called an opt-out procedure. So this is when a parent or guardian's non-response serves as their consent to letting the student participate in screening. So basically you're saying, you explain, that your school is going to be doing the screening, and you give them kind of all the information about it, about the why, the how, the when, and then at the end say, if you do not want your student to participate in this activity, please let us know, and typically say by a certain date. The strength of this approach is really that it allows the best chance to reach the largest number of students to be screened. However, drawback is that if during the screening process or after the screening process, there's a student that's deemed to have a high level of need, you're then going to need to go to that parent or caregiver to get consent to help get them connected to either resources within the school or resources within the community. So that's about kind of getting parental or caregiver, consent, either active or passive. It's also recommended that your screening team gets students' assent for participating in the screening. And this is often done at the beginning of the administration and often is provided as an option for the student to indicate, yes, I will participate in this screening, or no, I choose not to participate. When you ask students for their assent, it should be made clear to students that there are no disciplinary or academic consequences for choosing not to participate. So once you've decided, if you're going to use active or passive consent, then you need to make a communication plan so that students and families are fully informed in multiple ways about the mental health screening event that you're going to be holding. We recommend that you do most or all of the following things. 1, send out automated phone and text messages to all families about the plan to do the mental health screening, the reason why you're doing the screening, and when it will occur. It's important to have that same information or similar information should be posted on the school and or district's website. And this should also be sent out both in email and mail forms, snail mail forms to families, that we're reaching out to them, you're reaching out to them in multiple ways to make sure that they're getting the information. You should also create flyers that can be sent home with students and provide that same information to students and families at the beginning of the school year, maybe in some of some of the packets that students and families get at the beginning of the school year. Teachers and other educators should have discussions with students in class so they can ask questions and also be sharing this information with parents and caregivers at kind of parent nights and at parent-teacher conferences so that everybody feels really well informed and have numerous opportunities to ask questions before the screening event occurs. All right, we're moving on to the last phase of planning for your screening event. And this is around developing a plan for data collection, administration of the survey, and follow-up processes and procedures. Earlier we talked about the pros and cons of collecting your screening data electronically versus by paper and pencil. I just want to say again, increasingly schools, screening teams are choosing to administer measures through online platforms such as Qualtrics or SurveyMonkey instead of paper and pencil. Again, online administration allows for the efficient collection and management of data for the scoring and the follow-up purposes. One of the things I want to talk about here is if you are choosing online administration, your screening team must confirm that the chosen screening tool can be converted to an online format, and make sure to contact the author or publisher of the screening tool to make sure that online administration is allowed. Another component that your screening team will need to consider is data management and privacy according to FERPA and HIPAA. Your screening team will need to work with your district leadership and your district's general counsel to decide where the data will be stored, who will have access to the data, why will they have access to it, how will the data be used, and how long the data will be retained for. And if it's going to be destroyed, talking about the ways in which the data will be destroyed. All right, let's move on to kind of developing the administration procedures. One thing to think about, again, we talk about throughout this video, starting small. Your screening team may consider a small pilot administration, a few months or several months before the actual date of the full administration, in order to be able to troubleshoot any difficulties, and to gather feedback on the effectiveness of the screening process from students and families. This would also be an opportunity to bring in some of the cultural considerations and concerns, and pilot it with some from students and families of different cultures to see kind of what their response is, and how your procedures to support those students and families actually work. Again, you could do this piloting, can include giving the survey to just a small number of students in one grade or one classroom. And again, the purpose of the pilot is really to help you do a dry run to see, how did this work, and get feedback, and not only from students and families and cultural communities, but also from your school staff and your team. Sometimes doing it brings up other things that you should be thinking about. So another consideration when you think about administration of the screening is what time of day should you administer the screening. Times of day we recommend should be outside typical instructional time if possible. A common recommendation in the screening literature is to conduct screening during a student's homeroom period or advisory time if possible. If it's not possible, the screening team should really consult with teachers and administrators in the school building about what would be the optimal periods of the day to do the screening, and making sure that teachers are informed about the purpose and the importance of the screening. Also, it may be beneficial to conduct the screener administration earlier in the school day, so that older students who maybe leave early can be included, right? Students who maybe go on work study or PSEO or some of those kinds of things. Another reason to maybe do it earlier in the day is to allow for your screening team to follow up with students who maybe had a reaction to the screener, or maybe who need kind of immediate support to get that before they head home for the day. So again, some reasons to try and do it earlier in the day. All right, let's think about the staff. So what do staff need that are going to be involved? So what other supports do staff need who are going to be involved in the screening? All the school staff involved in the administration and follow-up to screening should receive clear, both written and oral communication about when the screening is going to take place, who's responsible for distributing the screener if it's paper and pencil, or making sure that students have the devices if they're going to be doing it online. They also need to know who's going to be responsible for being in the classroom. Earlier we talked about making sure that teachers and paras are in the room, but also maybe the school mental health professionals are also in the building, in the room, or some cultural liaisons and others are in. So again, thinking about who are the right people to be in the room and being very clear about that. Also giving them some clear information about how to handle students who are late or miss the initial administration, like how are we going to follow up with them? And then what to do for those students who maybe decline to participate. Making sure that you have another activity for them to do, or I'm just clear about kind of where they can go, what they can do while the screening is taking place for other students. It's also very helpful to provide staff with a script that they can read to students at the beginning of the screening process. This ensures that the screening process is standardized across your school. Some of the things to include in the script are the purpose of the screening, confidentiality of results, and why this is important to students, as well as step-by-step instructions about how to complete the screener. Really want to be infusing the CARE model into our screening work. So here are some important considerations to think about to make sure that your screening administration is equitable and culturally responsive. Make sure that you are providing both written and oral communication during the administration. And so for some students, it might be easier for them to hear, and for some students, they might want to read the instructions. It's also important to have, like I said, having those interpreters, cultural brokers, or bilingual staff in the classroom as needed to support any language needs or kind of needs around kind of cultural context and understanding around some of the screening questions, especially if you're not able to utilize a more culturally responsive screener. Make sure that you're reaching out to students who are absent during the screening. We talked about this earlier as well, but making sure that they also have opportunities to participate. We've talked a lot about this as the students are doing the screening and coming at it from that lens. If teachers are the ones doing the screening, it's really important to build in time before the screener, probably months ahead of time, after you've selected your tool, to really have some time to talk with educators so they can and provide them instruction and training so they can reflect on their own emotional responses to the tool and reflect on any prejudice or biases they might have and any cultural expectations they may hold that may influence their interpretation of students' behavior and their ratings of those students on the screening tool. Related to this, your screening team should be proactive in addressing any potential caregiver concerns regarding a teacher's reaction to or use of screening results and making sure that we're having that once the analysis has been done of the screening data, that we're having conversations classroom by classroom about the results. And this is also another place to bring in that care lens and be thinking about the results of the survey from a cultural perspective and bringing in those cultural liaisons and cultural brokers and other cultural experts to help us really think about the results within the context of cultural communities. All right, so now that your team is, we've completed the screening event, we're moving on to talking about some of those follow-up procedures. So I've talked a little bit about how do we bring in a cultural lens and really infuse that into how we're looking at the data. But now that we've done that, what are we how are we going to be using this, and what are some of the steps to be thinking about? So the literature on screening recommends that interventions are based on screening findings are implemented at universal, targeted, and intensive levels, or tier 1, tier 2, and tier 3 within your multi-tiered system of support or MTSS framework. Your screening team should really, ahead of time, be developing a resource map of your school-based and community resources and really organizing those resources at each level of the 3 tiers. And that way, your team can quickly identify services and supports for students at different levels of risk. Efforts to follow up with students who might need additional support should occur as soon as possible. And so they're kind of organized in a couple of different ways. So here, we've got the students who have a positive screen, right? And they need to be, kind of referred on for further assessment to better understand what the specific strengths and challenges are. Again, I think this is where that conversation comes in about it's a positive screen. Now, what do we think we need to do within the context of additional information that we have about a student? And so here are some recommendations for efficient and responsive follow-up. So one, if a student is at high risk, the team should respond to them the same day, right, of the screening. We need to get that student and talk to that caregiver and student right away and get them the support that they need. If a student is at moderate risk, the team should respond to that student and that family within a week. If a student is low risk, the team should communicate findings to the student and the caregiver, and then with that student's teacher and maybe other appropriate educators in the building within a reasonable time frame. And for these low risk students, that might be 3 to 4 weeks. So again, I think that making sure that you've got this plan in place, and you've talked with both your school-based supports and community-based supports to make sure that you can get these students connected to the right level of care in the right amount of time. All right, we have now walked through all 6 of the action steps to help you and your team develop a comprehensive plan to conduct mental health screenings in your school or in your school district. Hopefully, this video has helped you and your team feel more comfortable and confident in designing and implementing a screening tool and plan for your school. Thank you so much for watching this video. And please check out the other videos that we have on other parts of the Comprehensive School Mental Health Systems framework. Have a great day.